Okay, so these are my supplies. Here I have my two sodium chloride saline flushes, an empty 10 ml syringe, my hand sanitizer, my biohazard bag, my blood transfer device, a new access cap, alcohol prep pads, my blood test tube, my biohazard bag, and my gloves. And this is my patient, Mr. Bear. So I will first start by verifying the doctor's orders, and once I have verified the doctor's orders, I will go ahead and gather my supplies here. So I've gathered my supplies, and I would go ahead and wash my hands. So I'll go ahead and wash my hands first, and then I will introduce myself to the patient. Knock knock, hi Mr. Bear. So today the doctor had ordered a blood draw, and so we'll do a blood draw to test for your lab. So before we get started, can I just get your name and date of birth? Okay, so patient verifies name and date of birth, and then can I also can you tell me, do you have any allergies? No? Okay, so now I would do an environmental safety check, and so everything's fine, and then I would go ahead and put on my gloves. And then I would go ahead and at this time, I'll disconnect anything connected to the port at this time. And I will assess the site for any redness, swelling, or drainage, and the site looks okay. And are you in any pain right now? No? Okay, so I'll go ahead and start. So first I will take an alcohol pad and I'll open it up and I'll go ahead and clean the access port. And then once I've cleaned the access port, I'll wait for it to dry. And throw that away. And then I will take a saline flush and I will connect it and I will retract it and wait for a blood return. And once I see blood return, I'll make sure that it does not enter into the syringe, and then I can go ahead and start flushing, and I will use the pulsating method. Okay, and using the same syringe, I will go ahead and retract. Filling up the syringe. And then now I can go ahead and disconnect. And I will toss this in my biohazard. And then I will take another alcohol pad and I will go ahead and clean the site again, letting it dry. And I will take my empty 10 ml syringe and I will go ahead and connect it. And then I would go ahead and retract. And now my syringe would fill with blood. So filling that with blood. And then I will go ahead and take my blood transfer device and I will connect it. And then I would take my test tube and I would fill it with blood, filling 2 test tubes. Okay, and I'll put that right here. And I could discard this into the biohazard container. And I will clean the access site one more time, letting it dry. I will flush it, connect, and I will flush it with the same pulsating method. Meeting no resistance. Are you comfortable, Mr. Bear? Okay. And once that is finished, I can go ahead and put a new access cap if per facility protocol. And for the lab, I would label my specimen with the initials, date, time, and the site that it was drawn from. And I would go ahead and put it in my biohazard bag. And I would send these down to lab.